Okay, so let's talk about aortic valve diseases. And the aortic valve diseases are basically aortic stenosis and aortic regurgitation. When it comes to aortic stenosis, where is the aortic valve firstly? Just establish the basis. Where is the aortic valve? Okay, if this is the right-hand side, this is the left-hand side, and it's divided into 4 chambers between the left atrium and the left ventricle, and then between the left ventricle to the aorta. So, from the left ventricle to the aorta, that is exactly where you will find your aortic valve. And remember, the way it goes is that blood is coming from your lungs, and that blood goes to your left atrium. Then from your left atrium, this is oxygenated blood. Then the blood goes from your left atrium to your left ventricle. Then from your left ventricle through the aorta. And then from the aorta to the rest of the body. Now, if there's anything wrong with this aortic valve here, blood will not be able to go and supply the rest of the body as much. And one of the really, really important parts of the body are the brain. And when blood fails to reach the brain and and fulfill its oxygen demand due to any kind of stenosis in which the valve is narrowing more than usual, when the valve fails to completely open after the diastolic phase. So then if the brain is not receiving enough oxygen demand and there's not enough, this can cause syncope, okay? Which is one of the key features of aortic stenosis. Aortic stenosis can be described by syncope, angina, and dyspnea, and that's known as sad mnemonic. Now, when it comes to a couple of key differences between AS and AR, aortic stenosis is when, it's basically when, your valve, if it fails to open, this is the valve that's shut, and this is the valve that's open. When it's open, if it fails to open all the way, if there is some kind of narrowing, that is known as stenosis. Now, normally, the aortic valve has an open area of 3 to 4 centimeters. But in stenosis, this opening can be even less than 1 centimeter, which is a massive difference, and it's a big, big change, okay? Now, what else we will see? Well, in aortic stenosis, we have something that we've all heard of, concentric hypertrophy. Whereas which is concentric left, that is to say concentric left ventricular hypertrophy, because this is all going to affect the left side of the heart and the left atrium and the left ventricle. Now, if we go to aortic regurgitation, this is going to be eccentric. Is that how you say it? Hypertrophy. What's concentric hypertrophy? This is when your sarcomeres that are building the new and bulked up myometrial muscle. Remember, this left ventricular hypertrophy is nothing but a hypertrophic myocardium. And a hypertrophic myocardium is one which is getting more and more muscle added to it. Myocardium, muscle. Myo means muscle. Cardium means heart, and if it's getting more and more muscle added to it, concentric is when the muscle sarcomeres are added in parallel. However, eccentric or eccentric is when the muscle sarcomere fibers are added in series. So if you have any understanding of physics, you'll know the differences as well, and it's just kind of like, look how it looks. Okay, so what are the causes for aortic stenosis? Well, the causes can be, firstly, if there is a fibrotic or calcified valve, that can cause the valve to become stenosed and narrowed. Age-related calcification. Age-related calcification can be due to an increased age, or due to an increased blood pressure, hypertension, or increased cholesterol. Now, if you look over here, the causes for aortic stenosis can also be not just age-related calcification, but also some people, the actual aortic valve has 3 leaflets. And these 3 leaflets are posterior, right, and left. Now, in the case of somebody being born with a congenital, means congenital means being born with, congenital bicuspid valve, what that's going to mean is that instead of those 3 leaflets, you have 2 leaflets that are responsible for shutting properly or for opening properly. And this congenital bicuspid valve can occur in Turner syndrome. Okay. Now, the other thing that can cause aortic stenosis is any kind of rheumatic fever, right? So a chronic rheumatic fever. Now, I know rheumatic fever typically affects mitral valve. However, it can also affect and cause aortic stenosis. What's actually happening to the physiology of the heart when the aortic valve is stenosed? Well, less and less blood can go through the aorta. That means more and more blood will be in the left ventricle. And if more and more blood is in the left ventricle is going to have to work even harder. So if the valve itself is stenosed, you can think of it like this. If there's a lot of water in a tank and it all needs to be filtered through, if there's a big tube coming out of the tank, there will be a lot of space for that water to get through, and therefore there won't be as much pressure. And let's think of this water tank as a watertight tank. Now, if that same water tank, let's say like the left ventricle of our heart, has so much blood in it, just like this water tank, if that tube that's opening it is, instead of it being so big, if it's suddenly narrowed, what's that going to happen? That's going to mean that just like our left ventricle, just like our aortic valve getting more and more narrowed, this is going to cause an increase in pressure. And if it causes an increase in pressure over time, as our left ventricle has to work harder and harder to pump this blood out into the aorta, it will expand and have something called, that I already mentioned, left ventricular hypertrophy. And what's left ventricular hypertrophy to do with? This is actually the concentric type, as I mentioned. And it's just going to make the muscle thickened and thickened. But actually, this is a vicious cycle, because even though the valve narrowed, it's going to cause left ventricular hypertrophy. But even though, because the valve is still narrowed, the heart is still going to have to work harder. And then there's going to be muscle that's building up, but it's not actually effective or useful because there is still a valve that is narrowed. So that's quite important. There's 1 or 2 more things that I'll just let you know about. When the valve is narrowed, let's think about our aorta. And let's talk about this. Well, remember I told you that there's 3 symptoms: syncope, angina, and dyspnea. Now, why might there be angina? Well, firstly, why might there be chest pain? This is chest pain. Angina is defined as chest pain in the presence of increased oxygen demand that's not entirely being met. Now, I mentioned already about left ventricular hypertrophy, increased muscle mass, increased oxygen demand. This can cause angina. But what about something else? What else typically causes angina? Well, if you have a blood vessel and if you have this plaque on it, if you have coronary artery disease already, and imagine then downstream of that, then now you have a stenosed valve, you have two factors in one. And this 2-in-1 deal is really, really harmful for the body and dangerous for the heart. And not only will this pre-existing coronary artery disease make the angina worse, let's say because of your coronary artery disease, only 65%, let's say, basically, let's say that there was more or less 65% of blood having difficulty trying to pass through because of this already narrowed vessels because of coronary artery disease. Now, let's say you add a stenosed heart to the whole picture, and if you add a stenosed valve, to the whole picture, let's say now the body or the heart is going to have the difficulty in exerting even more, even 75% of blood getting out. And that's going to lead to angina. Okay, one last complication in addition to angina, in addition to left ventricular hypertrophy, there's also congestive heart failure, by the way. There's congestive heart failure. Heart failure is only when the heart fails. The heart fails to provide and meet the increased oxygen demand of the body. That's heart failure. It's very simple. Besides heart failure, besides angina and left ventricular hypertrophy, there's one more thing. Now, let's say, you know these vessels here? You know these vessels? I already told you that there is a narrowed vessel because of this, and there's a narrowed vessel. Look, when the valve has become narrow, in aortic stenosis, when the valve has become narrow, okay, I'm using blue to draw RBCs. These RBCs are going to try and get through. These RBCs are going to try and get through a narrowed valve. As they do, these RBCs will break down and get sheared. And this will lead to something called microangiopathic hemolytic anemia. And this is known as MAHA. And it's just a fancy name or a fancy way of saying anemia due to sheared or ripped or just broken up RBCs. And what's the clinical name for these sheared RBCs? The clinical name is schistocytes. Okay? And those are the key terms you need to know for aortic stenosis. When it comes to aortic regurgitation, I will come to it in the next one.